Hey everyone, hi. We just have gone live. We're getting ready to have a great conversation tonight with our guest, Kathleen. Looking forward to diving into our topic tonight and talking about all things Portugal. If you are new here, please say hello and let us know where you're signing in from. That's really great. We are here in Portugal. I'm in Alcobaça on the Silver Coast, and Kathleen, you are in Cascais, correct?
That's right.
That's right.
Very nice, very nice. So we're just going to give everyone here just another second to get signed in, and then we're going to get started. So we've got Julie here. Hey, Julie, it's great to see you. You're here in Portugal. I love the fact that you're here in Portugal. And just a heads up, Julie, I follow your Facebook posts. I love what you're posting. You have an amazing way of communicating, and it's been too long. You've got to come up so we can say hello. So great to see you, Julie. Jody, hey, nice to have you here as well. Jody and Mara from the US, but you're in Lisbon visiting. So great to have you here, Jody. Thank you so much. And we're just going to jump in here. If you have questions, please feel free to put them in the chat. Kathleen and I are excited to share our experiences here in Portugal and from our perspectives, and of course, really talking about what Kathleen is doing with Transitions Portugal. So hello, Suzanne. It's great to have you here from Florida. So nice to see you. We're going to dive in. Today, we're really, really proud to be able to share an opportunity to talk about what it's like to relocate to Portugal when you're moving through the trans community. And Kathleen was a client of ours about a year ago now, right? You moved
That's right.
in January a year ago, and she is here with her family of three. She has two teenagers and an 8-year-old, plus her husband who's here, and they've made this significant move over from Pennsylvania. So for what Kathleen has done is really created a project to help people through this process, especially moving with children, and if you're looking for specific information. So before we get any farther into it, Kathleen, I'd love if you could just share a little bit of your backstory, how you got to creating Transitions Portugal, and welcome.
Thank you.
It's great to be here. So my family of 5, we moved here from Pennsylvania back in January, and I have a trans child. And I immediately started getting questions on Facebook or through different groups and my signal chats and different communities about what is it like, what's it really like, how did you find resources, what's available there in terms of gender-affirming care, what are schools like. So I started answering these questions, and it was a lot. I also have a part-time job myself. Parenting is pretty full-time here when we moved. So I thought, let me put this together as something that can, help sustain my family and also help other people's families make this move and thrive in Portugal. So I thought about a lot of the questions that I had when I was moving that I didn't have anybody to answer, and then started fielding more questions and started working with people to help them do some boots on the ground research, share from my experience, and also tap into my network here about with specific questions. Can I get this prescription? What is this school like? I can tap in around my community to find answers to those questions for people.
And did you feel like, I think the first question, at least from our experience, that we see with our clients that are looking to relocate is they're very concerned about communication. The language piece, beyond the cultural, just the most simple things like explaining what type of prescription you need or finding the doctor that speaks fluent English that you feel comfortable with. Did you find that difficult when you arrived? Was that something that you've been able to kind of navigate? How has that been for you in the process?
We've been very much able to navigate it. Most professionals I find that we've been connected with do speak English very well. And we're learning the language. And we're about a year in. And I just took my daughter to the ER actually recently, and the intake nurse didn't speak that much English. So we used our Portuguese and we got through it, described the symptoms and figure out the next step. So, you move through that phase pretty fast. I'm getting a lot of people are getting a lot of feedback on my audio.
All right.
They're saying. I'm not quite sure what to do about it. I have my AirPods in.
Thank you, Julie, for letting us know because I'm not hearing it on my side. So we'll see if we can maybe turn down your volume a little bit, see if anything on that side helps, if it's picking up. Let's see if we can play with that a little bit to make it easier. So, so it looks like you're also hearing it on mine. So interesting because I don't think, Kathleen, are you hearing anything on mine that sounds difficult to understand?
No. But when I speak,
I do hear a bit of an echo.
Okay. Jody,
others are hearing it.
Is it when I'm speaking by myself or is it when just Kathleen's? Okay. All right. Well, Kathleen, maybe try muting and unmuting or seeing if we can switch around. Maybe turn off the computer microphone for yours. So see if we can play with that. While we take a moment with that and we'll chat a little bit about, in general, the things that we're finding from Portugal's point of view for folks that are moving here that are in the trans community. And we're very proud to be able to recognize the fact that we have a host of families that we've worked with that have relocated both with children and as adults and have been navigating this whole process. So I think that one of the things that we really want to make sure that you're able to communicate here is if you have questions, feel free to jump in because if Kathleen hasn't had a chance to experience it, more than likely, we've handled it as well. So please feel free to throw your questions in the chat. Now I'm going to try muting Kathleen. And then the question that I have for you is really, are you in the private system or are you using the public system or a combination of both when you were referring to your experiences with the medical?
Sure. So let me just, if you can hear me. I think now I don't hear the echo and you can hear my voice. Okay. So we are currently using the private healthcare system. Once you are a resident, when your kind of visa goes through, you get your residence card. They said perfect. Okay. So we'll just have to work like that, I think, with the sound. You can join the public healthcare system, and that has a lot of advantages in terms of particularly costs of medicines I've seen. However, I don't know that it gives you that much more in terms of, for LGBTQ kids, access to providers that you would be looking for, like mental health, gender affirming care, that you might want to go through the private system because there's fewer of them around. Your wait time would be generally less, and you'd have fewer let's say, regulatory hoops to go through in terms of having to follow a specific number of steps and getting referrals and the letters and seeing certain providers before others in the public healthcare system, where you can, if coming in as an expat or an immigrant into the private healthcare system, you can get faster access to some of those providers.
So a question would be, how was it getting health insurance for you and your family? Was that a concern or a consideration when you were looking at getting your health insurance?
You know what? It was a bit of a question, and then it was a non-issue. Like we just got the health insurance, and then care is a gender affirming care, mental health care. It's part of the healthcare system, and it's just part of what's covered at whatever rate that they're covered at. So it's not a question here like it was in the States. Will it be covered? Will it be not covered? It's a non-issue.
So Julie's asking if you needed to get letters from your U.S. providers. And in her case, it's been over 20 years. Did you feel like coming with documents helped with getting referrals to providers? Any circumstances where you needed them, or did you feel like you were pretty able to explain it without any documentation?
For the most part, we could explain without documentation. And particularly, most of my experience, I will say, has been in the private healthcare system. I would just bring things like your medical records that they would need to know with, you know, in terms of scans and diagnostics you've had, or, you know, the medicines that you've taken, and your prescriptions. But for the most part, in the private system, you don't need referrals and letters as such. You might, is it considered pre-existing? You might need them in the public system. I don't think that's a good question. Is it considered a pre-existing condition?
So I can help with that because we have had some circumstances with adults. Now, of course, this is all case by case where they were insured and it was considered a pre-existing condition for not declined, but there was a waiting period for certain diagnostic tests or certain follow-ups if you wanted to continue any kind of gender affirming care. Surgical procedures, there was like a wait time, just like anything else. When I got my insurance, I have a pacemaker and I had to wait a year before I could have it replaced. So it was a pre-existing condition, but it didn't cause the inability to get insurance. And we've had clients in that same situation where if they were looking to have another type of procedure or needed some additional tests or something, it may have a waiting period, but it didn't create a situation where they were declined. Mm-hmm. Definitely something that is a little bit case by case, but in general, the insurance situations here are different. So it hasn't been as difficult. So April has a question. I have 2 trans children. One will be an adult, 18 years old, and the other 16-year-old when we relocate to Porto next year. They are both currently receiving gender affirming care and are on HRT. One is on estrogen and the other on testosterone. Are these both available through private insurance in the Porto area? Can we transfer?
Okay. Yes, available. Let me say, I'll kind of answer broadly about HRT. So generally in Portugal, they will prescribe HRT. It's recommended 16 and over. However, if you come in with already existing care from a physician in another country, they will often, in the private system, continue that care with you. So that should not be a problem. The trick is that getting your prescriptions filled. So I would recommend you definitely want to get appointments with providers as early as possible, like book them, try and get them before you move, because we came in January, our first endocrinologist appointment was July. So it can take a little something to get them scheduled, and then you can get your prescription in Portugal. Depending on the type of HRT you're receiving, some estrogen you could get at a pharmacy here with your a recent US prescription. Sometimes you can do that. It kind of depends on what you have. That's something that somebody on the ground could potentially help you look at a pharmacy. I could do that with people, ask, can this be filled here? And then testosterone is trickier because it is more regulated, so that I don't think they can fill a US prescription. So again, you'd want to bring as much as you can with your prescriptions and then get your provider appointment so that you can get a new Portuguese prescription.
Absolutely. And for clarification, prescriptions are different. Your insurance company, your private insurance is not going to be covering your prescriptions like we do in the States. So that's an important piece. Everyone in Portugal that is a resident, once you have your residency card, has access to the public health system, which is including the prescriptions. So depending on your private insurance or if you're on the public system, the prescriptions are all level set. It's the same for everyone. You don't get a better prescription by being on MGen as opposed to Allianz or something like that. It's not tiered like it is in the US. So that's something to get used to, and that's also a benefit. But because it's regulated, you will need to have, as soon as you can, have those prescriptions turned into Portuguese prescriptions so you can go into the pharmacy and continue to have those filled. So it's a process that works, but it doesn't, your prescriptions aren't tied to your insurance. It's more tied to the health system. So it looks like, let's see, and April had, okay, so it's the endocrinologist here. So how difficult was it, Kathleen, for you did you feel comfortable with the first endocrinologist that you visited? Have you moved to a couple of different ones? How was that process of getting comfortable with the care that you found?
So, I mean, we've been very comfortable with the providers that we've met here. And it's never been for us now, fortunately, we're in the Lisbon Cascais area. We mostly go into Lisbon for our gender affirming care providers. And it hasn't been, I think the mindset here is very much that it is, yet another medical conversation to have, and what's right for this child and what's right with this family, and that's what we shall do. And it's kind of void of the politics, if you will, which is great. So the providers that we've met with have been excellent.
That is something that we found as well. And I'm glad you brought up politics, because I think as Americans, and I would guess pretty much everyone that's going to be watching this is probably coming from North America and the United States. We're coming with a lot of weight that moves with us, and there's a lot of anxiety. And when I've tried to dive into conversations about Portuguese feelings about the transgender community, the LGBT community in general, it's so not very exciting. It's almost like well, it's just what it is, and then they just move on to something else, as opposed to the dissecting and which side are you on and are you an ally. And a lot of those terms and words and things we do in the States, it hasn't really developed here because it hasn't been. Have you had that same experience where it's just not political? It's not as interesting. They're like, okay, so that's what's going on. Great. Let's move on and drink a glass of wine, kind of a thing.
Yeah, my husband and I, when we first got here, remarked that there weren't pride flags around or posters, or there were a couple places signs in the windows, but because it's the attitude. It's just so it doesn't feel necessary. Like, it's just go live your life, and it's not at this point. As necessary.
Jody has a question. We would like to hear about the social world for trans teens here. Accepted, issues, school. This is right up your alley, Kathleen.
Right up my alley. I got so many kids in so many schools. So it is, let's see. There's a wide variety of schools that you could attend. So I'm going to speak more to probably the international school scene. You could go to public Portuguese school and do it all in Portuguese, and or you could do international, or you can do kind of a private Portuguese school as well. There are some bilingual schools as well. My youngest is in a bilingual school. How do you answer this question? Could be a bit of a mixed bag, but generally it's a good experience. So I think, like anywhere you go in the world, if you're just in the world today, if you are a trans teen, you have decisions to make about whether you are public about this, whether you are stealth about this, whether you are, I talk to families about trying to decide, do we tell the school administration? Do we go stealth to the school and all our paperwork's already in the new name, and new gender, and so we can just go to the school as our current identity, and that's it, that's who we are. Sometimes families tell the administration so that they know, and they have adults who know, but they don't. They're stealth with the students, and they're passing in their gender. So it's there's things to think about. Is how does your teen like to present their gender identity, because that can vary by teen. Some teens have come over and just been completely stealth to everybody, and only the family knows, and it's like a fresh start, and it's amazing and freeing for them, and a wonderful experience, and no problems generally, I have found. Others share with their friends, others are wide open about it. There are, just to say kind of the things to think about, is that it is a Catholic country. There are some conservative viewpoints. In any international school, you're going to get people from all sorts of nationalities. And you're dealing with teenagers. So it can vary by school. It can vary by region. It can vary. I can say my kids haven't had any extreme bad situations. I haven't heard about people having extreme bad experiences as a trans or an LGBTQ teen. I have heard mixed experiences, but nothing severe.
So Kathleen, to just build off of that, so the school, how about the extracurricular activities and the social scene of just connecting with friends? You know, that's all important for teens in general. How has that been, and how have you seen that going for your families and community that you're working with?
It's going well, I would say. I think a lot of, a handful of teens have gone just completely stealth, but a lot of them, it's kind of they come out to their friends and not to others, and they just roll. I think teens anywhere are going to find their people, and so you can, go to a school and find your people for the most part. And I do also recommend, if you can and if you have the time, really going and touring a school and getting a feel for it, reaching out to Facebook groups to find families who have kids there, or I can help connect with people, with families who have kids at different schools to find out what is it really like. And what I have found is the feedback is different from different grade levels in schools, just because of the cohort of kids. So the good news is that legally the kids are very well protected from, discrimination and bullying. But then we know kids are kids. So it's not rainbows and unicorns, but it's generally been a great experience for me and my family and a lot of kids.
So Jody is following up with, how do kids who do not pass manage? So if they're early on in their journey, or they strictly don't pass, has that changed the experience that you've been aware of?
To some degree, because they don't have the option to go stealth, to just be stealth, and if they don't pass. So I don't have a lot of experience with kids in that situation. I think that is something to think about. It's going to be personal to every kid, because it is, again, you're in a school with teenagers, and so there's going to be a mix of personalities and perspectives, and a very international perspective, and there are some cultures and countries who are more conservative than others. So it's a little tricky. I think it depends on the kid, and I think then you want to do your due diligence on the schools to find out what is it really like on the ground in these schools, and what are they going to find there? What's the experience like?
Absolutely. We talked a little bit about the healthcare system with the endocrinologists and finding prescriptions. How about the services that support families and the individual through the mental health care, the counseling, just having outlets for support like that? I do know that for most in Portugal, that's a little bit tricky when we first get here, because finding the English-speaking person, especially if you're not in Lisbon, all of that is where the language really has to be pretty proficient. How has that gone for you, and how are you seeing that side of it for that type of support?
So there's a growing number of resources, I feel, in Portugal, and again, particularly in the Lisbon, greater Lisbon area at this moment, where there's more and more groups that are dedicated to this or have this listed as a specialty. You've got Cascais, you've got Cadin out here in Cascais, you have PIN. So there's different groups. I would say it's a growing industry, if you will, or a growing resource becoming more available. So we were able to find a psychiatrist, and then a therapist as well, which is interesting, because I find mostly here it's psychotherapy or the psychiatrist, and the therapist, like somebody to talk to and not to prescribe, is a little less prevalent. But we have been able to find some great resources that my kid feels comfortable with.
So that's really an interesting point, because what we're finding from our client base, from the community that we've built for the last 4.5, almost 5 years, is there are a lot of therapists that are relocating from the United States that are coming with backgrounds with this specialty and counseling, that are able to kind of integrate their business that they already have online, because a lot of folks moved to that format, of course, during COVID. And they're also finding another market of being able to support and help people outside of the Lisbon area. So we've seen a trend. It's certainly not all over, and there's still a lot more space for people that may want to come over with that kind of background. But we are seeing more and more people that are understanding that there's a community that needs support and making their services available. And also, just to speak to Portu, just because we do have clients that are up there, there is a pretty good network of private clinics, endocrinologists, therapists. Portu is very robust with all of the same types of opportunities that Lisbon has. The Algarve being the other largely populated area that has some significant populations is less so. Just because of the transient nature of the Algarve and the fact that there's a lot of holiday homes and it's more targeted in many cases to like an older retiring population, they haven't quite caught up down there as much with the support. But we are also hearing some really positive movement towards providing services and additional support to all students, but also folks coming from different backgrounds in Coimbra. Coimbra is starting to really show a lot of development as people have identified that as an area. And even here on the Silver Coast, Leiria we have 2 international schools. There's public and private schools here now. Torres Vedras has an international school. And we're also seeing therapists and doctors here that are becoming available. So it does feel like in the last 5 years from our experience that we're finding more services for people when they're asking than we certainly had when we first arrived. So, and Kathleen, you help folks across, like if somebody wanted to work with you to help get this information, you can find this in the urban areas, correct? That's what you've been focusing on?
Yeah, I'm also trying to build a network within Portugal of families as well, so we can share information and resources.
Okay.
So I can tap in.
Mm-hmm. So Suzanne says she is a therapist and is very, I think that's great because there is a significant community in Portugal that is moving and relocating, and there's many, many more people, at least from our experience. And Kathleen, I'm sure you're probably in the group seeing this as well, that are looking for a different and fresh kind of opportunity. But the therapists and the support is needed. And so there's definitely space, I believe, still for people that are coming in. So absolutely. So on another note, when we're talking about your family, and we kind of touched on this briefly when you were talking about Portugal being a Catholic country and everything, have you experienced any feeling of being othered or feeling like you've been set aside or having that strange feeling of being, because as immigrants, we're all uncomfortable a little bit because we're automatically other, we're automatically outside of the center of the culture. But have you felt that there was any place you've traveled to or gone to where you did feel that you were being particularly focused on or put aside because of having a trans child?
No. That's the short answer. No. Mostly, I think it doesn't come up unless it's in a medical context for the most part. And again, there it's a non-issue. That's what we're here for, is a medical, treatment. And then otherwise, mostly if I'm explaining our situation or, why did you leave the States? People are understanding. Mostly I have found people to be understanding.
So for the community that we've served that are the adults that have relocated, one of the big concerns has been the sense of safety, of feeling like not being targeted, the ability to just, live your life and not feel that you're in physical danger. And I can also speak to I have a daughter that's in the LGBTQ community, and it was always a circumstance in the States where you always worry about your child. And then when there's layers of things that add to that, being targeted, being, selected because of something that people feel makes them vulnerable, it just adds more. And for the community we worked with of adults, and for myself and our own experience, we have not had a single issue reported to us of any kind of any significance. And for our own family, it's been such an incredible change to not have that weight. There's always other things, but when that weight of fear, of the anxiety, of the concern that if my daughter and her girlfriend are walking and holding hands, there's just nothing. It isn't a thing. And it's also the fact that there really isn't any gay section of a town. There isn't really like you said, no flags or rainbows on the streets because they don't need a separate place to feel safe. You can just go in the restaurants or go to the shops or go wherever. So I think for a lot of folks, safety is a real feeling. Was that a discussion before you moved? Was that one of your concerns about that element of safety for your child?
Yes, and it was a big factor in our research and where to go, because it's not like we've had Portugal wasn't really on our radar until we started looking for where could we go that is safe, that has the, infrastructure and the schooling that we need, but that would give us that sense of, where you've got legal protections and you've got healthcare available, and my kid and my family can live here and thrive and be ourselves and be who we are and, have that right to thrive. And that showed up for us here. It was a big factor.
You had the opportunity to travel outside of Portugal across Europe yet since you've been here. Have you had a chance for the family to leave Portugal?
No, not yet. Not yet. We're making some plans for next year, but there's so much to see here. We had actually never been here before we moved, so there is a lot to see and explore just in this country, and we're getting our feet on the ground, and then we'll spread our wings a little more.
So can you tell us a little bit about what Transitions Portugal does? Tell us a little bit about the program you've created and how, if we have folks here that are interested, what your service would provide and how you can help.
Sure. So, I'm very much committed to being a resource for people to be able to, because I was in this situation not that long ago, a year ago, like right at this time where I had a lot of questions. What is it really like? What can I get done on the ground? What will this be like for my kid and my family? What will I have access to? And so I want to be that resource for people. So there's different ways that we can do that. We can just, get on Zoom conversations and I can answer all the questions about my experience and others that I've worked with and people that I've spoken with, and just answer those questions. What's it really like? Or what should I be thinking about? We can also get very specific. We can talk about, specific schools. I'm more familiar with the ones in this area, but again, have contacts and resources around the country. And so we can get more specific into particular healthcare questions, prescription questions, school questions. How do I go about building community? Things like that, where I can share from my experience. And then I can also just get kind of like what I said, but kind of do a lot of on-the-ground research. So if you want to know about certain schools, certain neighborhoods, certain things, I dive in and, being here, using my networks, moving around myself on the ground, can tell you what it would really be like. So and then whatever else comes up, I keep finding, getting new questions and new requests, and then that now becomes part of my repertoire. So it's really, like a friend in Portugal that I wish I had that can help answer those questions and make you feel good about the move.
Absolutely. So they can reach you through the transitionsportugal.com, through the website, and can they schedule a call there, or do they reach out via email? How does that work?
So you can schedule, I can do a 15-minute kind of complimentary, let's just get to know each other, see if this is something you want. You could go right in and book an hour with me to get all, as many questions answered as you can. And then I have different programs and kind of more of a full package or something like that, which you can just express your interest in, and then we would talk first and see what really makes sense for you. But you can book through the website.
Perfect. I think April has an additional question here. What would you say are the most important things for parents to prepare before relocating their trans children? Medical documents, diagnosis, prescriptions, etc., and in what format is best, like USB drive, paper, or professionally translated?
Okay, I didn't have anything translated, and that has not been a problem for me. Paper is good because you're probably just going to I brought that huge folder to the appointments. And you want to get as much as you can. So like we had the initial, like your DEXA scan, your bone scans, your blood work. You want all of that. You want your growth charts, because they do, want to make informed medical decisions. So as much as you can, a lot of pediatricians or hospital systems you can kind of download your whole file. And then you might want to pick and choose the things that you bring to your first appointment. But I think those are the kinds of things that you're saying. Certain diagnoses, definitely bring copies of your prescriptions, which you're going to want to bring anyway. By the way, I recommend, if you can, before you come, get like a 90-day supply of your prescriptions, just so you have them for, until you can get everything sorted. I did bring, in terms of what format, I had like a CD of one of our scans, and fortunately, one of our doctors could look at it. Another one that we saw didn't have the ability to look at that. So that's something to think about. If you can switch those to a USB drive, that's probably wise. But generally, I brought most things on paper to these appointments.
So it's interesting. One of the things I hear quite a bit is also about supplements. People taking the non-prescription side, the supplements, the things that they're using, and that I've found to be a little more expensive in Portugal and less readily available. I use iHerb for a lot of supplement just to be able to get the supply and to manage the cost. Has that been an issue for you? Are you navigating your way through any of that? Have you had any of those experiences? Because we talk a lot about the prescriptions, but then there's a host of that we're not always prepared for not being able to get outside of the prescription side.
That is a good point. There was a little bit of that we had, and we were able to find some things through Amazon. I mean, through Amazon Spain, some things are available, or they're just a little bit cheaper through that route, which is what we use here. It's usually you can't get the thing same day, but you can get it generally. But that is an avenue, or some different mail order items. But we haven't run into it too much on our end, but it's a good call out. It's a good point.
Folks, I think one of the things that surprises people in the pharmacies in general, if you haven't lived here yet, is how different medicine is handled. Like you just don't have these long aisles of medicine where if you have a cold, you go in and there's like 30 options. Here, you go to the pharmacist, you always take a number. This is, if I can send one key piece of advice, do not skip the machine with the little number. That is key. And then you're going to talk to the pharmacist, even if you have a cold, if you have a headache, if you have a stomach issue, most of it, they're going to then give to you, even if it doesn't require a prescription. So I think being prepared for that, if there's anything that's not prescription, but is comfort or something familiar for your child, get as much of that before it would expire. You have to watch the expiration dates to bring with you so that you can transition to whatever it is in Europe, but not make it such a abrupt change. Because that's, I think, shocking to a lot of people. They think they can get Tylenol, for example, and you can't. It's different. So whatever your child's used to taking, if they get a headache, if they get colds, whatever those kind of things, think about those as well, because I think that catches people a little flat-footed sometimes.
That's a good point. We did some of that as well. We brought the Dimetap, we brought the cold medicine that they are used to, and the headache medicine and the allergy medicine that they're used to, that we would just get over the counter. And then we had to figure out what the equivalent to that was here, which often you can go to the pharmacy, you can bring it from the States, you can just talk to them about, I need some, I would just go, I need something for my kid's headache. And they're like, oh, you can have this. Do you want it this way or this way? So you just have to be willing to talk to the people. But that's a very good point that, yeah, we did bring. You want to bring a supply.
Well, we definitely feel very comfortable and confident being able to say that Portugal is a place that's safe and you feel welcomed here. No place is perfect. I think you said this earlier, it's not unicorns and rainbows, but it is peaceful. And it's calm. And for many of us, the rest of it is all just life. But to be somewhere where we're safe and where we feel comfortable in our own skin, I think is a big part of getting that new reset, that new life. If anyone out there has additional questions, we're going to be wrapping up here in a moment. Of course, if you registered for the webinar, we're going to be sending out the recording of this. But it's really important to stress that, Kathleen has really brought forward a service that I think is great and so needed for people, especially relocating with children. I think this is wonderful what you're doing, Kathleen, and sharing that. It's very much aligned with what we do, which is just taking from our personal experience, building community, and trying to help people navigate a process that for everyone is tough, right? It's a big shock, and then you add another layer of something. It can get overwhelming. So I really appreciate what you're doing, Kathleen. And remember, it's Transitions Portugal. Are you on social? Do you have a site? Is it Facebook or?
I'm
on Facebook and Instagram.
Okay, so
Transitions Portugal.
So we can find that through both of them. And then from Portugal The Place side, if you don't know our services, we can absolutely help with all of the relocation pieces, either virtual rentals, if you need to come and see Portugal for the first time and go on an immersion experience, if you'd like to purchase a home, all of those different moving parts. We have a team of people across the country that can assist. But one of the things we really love is this kind of community where we are really trying to pay it forward and help the folks that are coming and learn from a lot of our mistakes. Sometimes it's just don't do what we did and then you'll be fine, kind of a situation. But if we don't have any further questions, Kathleen, I really thank you once again for taking the time to be here with us. And I wish you and your family a very happy holiday. And again, to everyone out there, thank you so much for tuning in. And we will have another webinar, a general question Q&A coming up. We have another one that is going to be on December 22nd. So that is available for you to sign up as well. And Kathleen, thank you again. And we will see you all again later. Thanks so much. Bye now.
Thank you.
Thank you.
Bye.
Bye.